Hello everyone. Welcome to this audio podcast. This audio podcast, as part of the component and Storm and the Bostics. This audio podcast is part of the LabZtorm and Diggamount. This audio podcast, as part of a Shipmo squad. This audio podcast as part of a Storm and the Bostics production. So this audio podcast will look at and go into a little bit around guidelines and frameworks. So although RBTs and the United Kingdom is now very safe or are very safe, at the same time the most serious adverse events or effects originate in hospital environs rather than through for example blood transfusion centers. However, at the same time, ensuring safe and effective blood supply has still remained sort of an essential basis, and this requires a combination of high quality donor recruitment, high, 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 high quality donor recruitment and selection, infection screening, serological investigations, and blood component production. And at the same time, the is where the 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 UK the joint UK blood transfusion services, or UKBTS, and the joint professional and so the joint professional advisory committee, or JPAC, are responsible for producing the guidelines for blood transfusion services in the United Kingdom. And um, in 2011, for example, the UK blood services issued 2.1 million units of red cells, 300,000 platelet doses, 300,000 platelet doses, 288,000 units of fresh frozen plasma, and 126,000 units of cryoprecipitate. So laboratory specialists and practitioners enhancing skills should look to review guidelines and frameworks, understanding the strategies for transfusion therapy, which should strategies for transfusion therapy aligned to additionally with the National Institute of Clinical Excellence, or NICE 2023 NICE 2023 sort of basis of in line to impaired eGFR, or estimated glomerular filtration rate, aligned with anemia. So using wherein the guidelines in the NICE 2023 guidelines, there is a sort of a particular threat a particular a particular level, or laboratory level, or threshold, for example, threshold or a level that looks to look in around anemia, and the need for in addition to the need of a particular treatment, of pharmacotherapeutic modalities. So reviewing guidelines are recommended to ensure practices are inclusive, and at the same time, the mean hemoglobin declines as eGFR is impaired, and so this then induces subsequent stages. This then induces the sort of stages in around what is referred to as chronic kidney disease, or CKD, and this is when anemia then catches up with additional clinical symptomologies. And so, in context of SCA and thalassemic patients, where there is a sort of in as part of guidelines and frameworks, SCA guidelines and frameworks. For example, there has not been as much in around sort of documented or evidence works in around the sort of pertinence in around eGFR health, or estimated glomerular filtration rate, since at the same time kidneys or kidney function, and in context of erythropoiesis and red cell stimulation, red blood cell stimulation through the kidneys is one of the sort of main bases, or main organs, for example, that are important in around aligned to eGFR, eGFR, and so in context of sort of SCA and thalassemia guidelines, there have not been as much as much documented sort of linking or interlinking the sort of eGFR health aspect as perhaps there should well be. So that draws this audio podcast to a close. This audio podcast is part of the LabZtorm and Diggamount. This audio podcast is part of the Coppola and Storm Robotics. This audio podcast as part of the Shipmo Squad. This audio podcast as part of a Storm Robotics production.